Hello and welcome. My name is Dr. Zwan Qureshi, and this video is particularly in response to my assessment of quite a lot of number of applications of MS, MD, and FCPS specialists who have completed the postgraduate training exams back home in Pakistan, in India, and also they've completed the exams and they want to apply for the specialist comparability assessment here in Australia. And I want to take this opportunity that I've learned a lot by doing their applications and dissecting the peculiarities of their training and their exam components and how it compares to that of an Australian training system. Now, I have got my reservation. I must be honest that I think that both FCPS and MD, MS, and DNB programs are very good. You get a lot of patient exposure, you've got lots of volume, and also the complexity is there. However, there are certain lacks in both the training programs after talking one-on-one to many of these specialist doctors. So in this video, I'm going to go and dive deep into the specifics of the training program and how do they compare to the international level training based in Australia, UK, and US when it comes to the specialist comparability application, and how do they stack up even against each other, because as I said, there's some unique components of both of these exams and it's worth talking about it. So without further ado, let's jump right into it. There's nothing more interesting for Pakistani and Indian to compare the two countries in the areas of cricket, music, entertainment, and on more serious note, economy, health, and education. In 2023, the Indian GDP was valued approximately $3.5 trillion US, which is about 3.5% of the global economy, while Pakistan's GDP is approximately $374.6 billion, reflecting a growth rate of about 2.5%. But then that's where it gets really interesting. India spends about 3.69% of GDP on health, while Pakistan spends approximately 4.57% of GDP to its health-related expenditure. But when you consider these percentages against the massive 1.45 billion people in India and that of 253 million in Pakistan, the per capita expenditure in India falls down to $74 and that Pakistan to $43. In comparison, the United States allocates nearly 16% of its GDP to healthcare, and their per capita expanding in healthcare is about $12,474 US. These figures point out to the fact that for an average person in both India and Pakistan, the people have poor public health infrastructure and population growth, and it does not help in these countries the situation from getting bad to worse. Now, coming back to the very important point about the postgraduate qualification, which countries provide better. The highest qualification in Pakistan is FCPS, and that in India it is MS, MD, DNB, PG training programs. Now in this video, I'm going to dissect the comparison training requirement, payments for PG training program, yes, that's the thing in India, competition of entrance into various programs, training positions, duration of training, international recognition, because lots of these specialists are going to migrate eventually to outside countries, and finally I'll lay out my conclusion for you to make up your mind. Now, entrance requirement and competition. FCPS Pakistan, the candidates must pass the FCPS Part 1 examination, which is a multiple choice based question in their chosen specialty. After passing, they can commence their training in accredited institutes. The competition is significantly higher due to limited number of training slots and growing number of the MBBS applicants which are trying to get onto the postgraduate medical training. MS and MD in India, all of the candidates who want to do this exam must clear a very competitive postgraduate entrance exam after completing their MBBS and internship. The selection process is rigorous, and the large number of applicants, they want to apply for the limited number of seats. The DNB is considered equivalent to MD and MS degrees and involves 3 years of postgraduate training. What about the payment for PG training? The important point here is that in India, it's also possible to pay for an admission to MD or MS training programs in private medical colleges. This is typically done under a management quota or NRI quota, which are illegally allowed seats in private medical institutes, and the admission could cost anywhere between 15 lakhs to up to 1 crore Indian rupees. In Pakistan, there is no such payment option in public or private medical setups. You either get into the program or you don't. Training positions. As of recent data, there are over 10,000 FCPS training slots distributed among 129 CPSP accredited medical institutes nationwide. In comparison, in India, there are 73,157 postgraduate medical training seats across the country. Now, these positions are distributed among both the government medical colleges and the private medical colleges, which are linked to the accredited hospital institute. And they provide pretty much all the medical specialties and surgical specialties. The FCPS training program typically is about 4 and in certain cases 5 years of structured residency training under supervision of an experienced specialist in a training hospital setting. MS, MD, and DNB are 3-year postgraduate training programs offered by various medical universities or colleges run hospitals in India. After completion of 4 years of FCPS training in Pakistan and 3 years of MD and MS training, the doctors can also opt for further training called post-fellowship experience, and that in Pakistan, and also it can be called as super specialist training experience in India. Now, duration of training program is hugely controversial topic in the various countries. For example, in the UK, the PG training is about 5 years, and in the US, the residency is highly variable. For example, in internal medicine, family medicine, and pediatrics, about 3 years. In psychiatry, emergency medicine, general surgery, orthopedics, neurosurgery, otolaryngology, and plastic surgery, the training program could vary between 4 to up to 7 years. I personally feel that in India and Pakistan, the postgraduate trainees have good experience by treating large number of patients. However, there's an issue. Due to inadequate facilities and the depth of training with certain high skills procedures is often very limited. For example, one of the orthopedic trainee was telling me in Pakistan, pretty much all of the orthopedic training is built on trauma and emergency in majority of the government run institutes with a limited exposure to arthroscopy and elective joint replacement surgery. Similarly, in ONG, they lack colposcopy, hysteroscopy, laparoscopy procedure exposure in government sectors. And this is both true for India as well as in Pakistan, which when it comes to the logbook training requirements, they do not fulfill the substantial training curriculum requirement when they're applying for specialist comparability. Now, after completion, FCPS graduate can pursue senior residency training program or fellowship programs or consultant roles in their specialty. The FCPS qualification is recognized for specialist registration in Pakistan, is considered equivalent to that of a master's degree by the Higher Education Commission of Pakistan. MS and MD graduates are eligible for senior residency, teaching positions, or specialist roles throughout the government and private hospitals. And they can also pursue a super specialization through DM and MCH programs in the surgical training programs and the neurosurgical training programs and the orthopedic training programs. The DNB holders can also work as specialist or consultant and are eligible for teaching positions. However, in some instances, DNB candidates may face challenges in academic appointments compared to MS and MD graduates. What about the international recognition? Certain FCPS qualifications are recognized by international bodies. For example, General Medical Council recognizes FCPS in anesthesia without the need for additional exams. Additionally, the Cooperation Council of Arabic States, for example, Gulf countries, typically Saudi Arabia, Qatar, and Middle Eastern countries like Dubai, Abu Dhabi, and Oman, it is recognized, FCPS is recognized for the consultant position. MS, MD, and DNB, these two are recognized qualifications, and they've been recognized for pretty much all of these countries. Some countries may require some additional requirements or equivalency evaluation. For example, Medical Training Initiative in the UK accepts candidates with MS and MD or DNB qualification for certain training programs, provided they meet the eligibility criteria to continue the training program through the UK training stream. In Australia, both MD and FCPS doctors can apply for specialist comparability assessment, which may lead to a partial or substantial comparability status upon training of further 1 to 2 years in Australia. Now, one thing to consider that there may be further exams like an exit exams or fellowship exam in Australia for these candidates who are coming after the FCPS and after MD, DM, and all of that. Now, training cost. FCPS training costs are generally lower in Pakistan, with many institutes offering stipends to trainees. However, candidates may obviously have to incur the examination, study materials, and the living cost if they are training in a hospital in some other areas, as opposed to the training into the sector where they are not living in. MSMD training program in India, cost of training can vary significantly. While government institutes offer subsidized education and stipends, private institutes may charge substantial tuition fees. Additionally, there are instances where candidates pay for seats in private colleges, as I've said before, increasing the overall cost of training, because you can buy yourself into training. I think both Pakistani and Indian have excellent postgraduate training programs when it comes to general postgraduate training, that is. However, the specific skills based on learnings are often limited in both Pakistan and India, and hence when the overseas specialists are compared to their counterparts in the UK, US, and in Australia, I think both Pakistan conclusion, I think both Pakistan and Indians have, I think both Pakistan and India have excellent postgraduate training programs when it compares to general postgraduate medical training. However, the specific skills based on certain advanced procedures like laparoscopic and arthroscopic procedure and certain high-level procedures, they might be often limited in government tertiary level teaching institutes. So when it compares or comes to the specialist comparability assessment in US, UK and Australia, these specialists who are fully trained, they might not be able to get that substantial comparability outcome, or sometimes even non-comparability outcome, because there are certain components of their training which does not quite equate to the postgraduate training program in the US, UK and here in Australia. If you like this video, please leave a comment. There might be some inadequacies in there. More than happy to listen to those inadequacies, and we'll take it from there. Look after yourself and each other. Goodbye.